And what will you do as governor to keep Wyoming's health care affordable?
I believe that there's been a tremendous amount of misinformation about the new health care law. As a small business owner, I welcome the ability to pool with other small business owners, because I know right now I pay 20 to 25% more than somebody who works in a large corporation. It's tough to be competitive with that. It also closes the donut holes for seniors, and as Wyoming soon will become the oldest state in the union, that's important. And it also allows the states to work out innovative approaches to their health care. A lot of people think that this is a federally dominated program. That's simply not true. The state has the ability to regulate their insurance. They have the ability to set up those health exchanges, and they have the ability to run their high-risk pools. So there is a lot of misinformation, but as governor, I would look to work with that system. I think that the suit is a waste of time and money. I think time would be better spent working within the confines of that system.
Chris Zachary, 1 minute.
This is one that has been interesting to me since the get-go. With my education in the field of working I was before becoming disabled, there's so much of that that's still in the gray law. And it's going to take a tough governor. It's going to take a good director of mental health and as well as health care for the state of Wyoming. But as long as they stay on it, I agree, court's not the answer. That's going to tie everything up and to slow the process down. It's going to take somebody with some education to say what we can and cannot afford for the state and what our people can afford and what we can.
Leslie Peterson, 60 seconds.
I agree with Pete. There's been an enormous amount of misinformation about what the new law will do, although clearly it's a very incremental thing over several years, and regulations are being adopted, so no one's really an expert on it yet. But let's remember that the healthcare system we had in this country was not sustainable. The cost of premiums was going up rapidly. No one could maintain it the way it was. And we had 70,000 of our people here in Wyoming with no health insurance. We had the greatest #1 cause of bankruptcies in this country was people getting sick. And we had terrible things done by the insurance companies by canceling people's insurance when they got sick and so forth. I would not support the lawsuit that would try to nullify this law, and I would carefully examine every aspect of it as it develops over the next years and take advantage of those things that will benefit Wyoming, and I would love to have more time on this.
Okay. Pete Gosar, 30 seconds.
As a state employee, I understand the importance of the wellness program. And as governor, I would institute some type of get fit with the governor. I've run a few 5Ks and have done poorly at best. And so the governor would be along those lines of getting fit with the governor.
Right now, the governor is charged to implement the health care reform. That's what a governor does. It's now the law of the land. I've been looking carefully. I've had two folks looking to work through that 2,000+ page document because I have said I want to know what's in it, because that's how will I approach serving as Wyoming governor. I'm going to know. I'm going to read it. I'm going to have folks help me. Right now, Virginia, of course, is getting a little play. The courts have decided that yes, they can bring it to the courts. We haven't heard much from the other 20 states that said they were going to band together and do something, because guess what? They have no standing. Virginia appears may now have standing. Bottom line is I will continue to support efforts like WWAMI. I was on the board of trustees when we started that program. Continue to recruit, train Wyoming healthcare professionals to serve in Wyoming.
Ron Michaeli.
This is a chance for a commercial. I'd invite you to visit our website at MikeLifeForGovernor.com, where you will see a video that we cut the day after Obamacare was passed, and I said, and I will continue to say, that it is the greatest intrusion of federal government into our lives of anything that's passed in my lifetime. And I continue to believe that that's true. I believe it's unconstitutional, and I believe that the state of Wyoming should be joining that lawsuit with the other 20 states, and if I'm governor, we will do that. It is clearly in my mind unconstitutional that a law can require you as an American citizen and demand that you as an American citizen must buy a product, a certain product. And if you don't, you are subject to fines and penalties. It is unconstitutional, and it is a precedent that we don't even want to talk about. So I believe that the first line of defense is that we have to join the lawsuit, and I'm out of time.
Indeed.
I think it should be challenged as well, but it's not enough to just say we think the courts are going to do that. Having been a prosecutor for a number of years, I know that what I think courts should do doesn't always work out. So you can't just stick your head in the sand and say that's what's going to happen. But we have to recognize, it's going to increase the Medicare payroll taxes. It's going to increase the number of Medicaid people in Wyoming, and it's going to have a real impact in Wyoming. And in terms of 2014, Dr. Sherrard estimates there's going to be another 25,000 to 30,000 people on our Medicaid rolls, and so we can't just stand still. We have to prepare. It's estimated that there's going to be additional 100 pages for every page of 100 pages of regulation for every page in the bill. And so the Governor's Office now and the Department of Health now are working through that, and I think that's the appropriate thing to figure out how we can best deal with it if it stands.
Colin Simpson.
Well, the premise of the question is that regardless of whether it's constitutional or not, how do we deal with it? We must reduce costs both from the practitioner and the delivery of health care. The legislature passed the health care pilot bill this last session to figure out how to keep people off the Medicaid rolls, and those people are employed 20 hours a week at least, have some workforce training, and it allows us to figure out how we get a handle on our Medicaid costs from the state of Wyoming perspective and help them become more responsible. And there's health, wellness, and prevention, and it's a great program. I sponsored a bill that passed about how do we allow for health insurance purchase across state lands to increase the availability and the affordability of insurance. Medicaid is a voluntary program. We can turn down participation in those, as we have done with the high-risk pool. The short-term question is, what do we do in the next 2 years when the federal share drops by 4% and our costs go up? I could go on and on.
Tom Euban, 60 seconds.
Well, as a citizen, I certainly hope that we do repeal this health care, because it's going to cost, I know it's going to cost me a lot of money, but we can't be selfish on everybody. It's going to cost everybody a lot of money. And I hope that Wyoming does take this to court with the other states.
Rita Meyer, you have 30 seconds.
As governor, the first thing out of my mouth when something comes across my desk is not going to be, I'm going to sue. I'm going to understand the implications first. I'll tell you what, Washington is already realizing the error of their ways. Just this last week, they're wanting to repeal part of that Health Care Reform Act. And trust me, they will look at it harder and do that. And that is the part that relates to small business, reporting a vendor $600 and less because or more. They realize that will absolutely stymie and stall the business economy across the United States.